Hello, we are Jesus Salazar Jam, Josué Yehuitinea, Margarita Kawich Espadas, Nayeli May Valdez from the Autonomous University of Campeche, from the Faculty of Chemical Biological Sciences, and we will talk about Kaposi sarcoma cancer.
Kaposi sarcoma is a cancer that causes lesions, abnormal tissue, to grow in the skin, mucous membranes that line the mouth, nose, and throat, lymph nodes, or other organs. The lesions are usually purple in color and are made up of cancer cells, new blood vessels, red blood cells, and white blood cells. Kaposi sarcoma is different from other cancers because the lesions can start in more than one place in the body at the same time. Human herpesvirus 8 (HHV8) is found in the lesions of all patients with Kaposi sarcoma. This virus is also known as Kaposi sarcoma herpesvirus (KHSV). Most people with HHV8 do not develop Kaposi sarcoma. People with HHV8 are more likely to develop Kaposi sarcoma if their immune system are weakened by a disease such as human immunodeficiency virus (HSV) or by medication given after an organ transplant.
Kaposi sarcoma is a cancer that begins in the endothelial cells, which line blood vessel, lymphatic, and the other tissues. The etiology of Kaposi sarcoma involves several factors. Human herpes virus type H infection, also known as a human herpes virus type H, is a crucial factor in the development of Kaposi sarcoma. This virus is transmitted mainly through saliva, sexual contact, and in certain parts of the world, vertical transmission from mother to child. Some of the ways human herpes virus type H influence cancer production, one of them is a cellular transformation, because the human herpes virus has the ability to transform endothelial cells with the line blood and lymphatic vessels, inducing the uncontrolled proliferation. This is essential for the formation of tumor lesions characteristics of Kaposi sarcoma. Also, the activation on oncogenic genes. The virus they can activate oncogenic genes and suppress tumor suppressor genes in infected cells, thereby promoting their malignant transformation and the development of cancer. Also, the chronic inflammation of the altered immune response to human herpes virus type H infection leads to the chronic inflammation and altered host immune response, which promotes to the growth and the survival of tumor cells. Interaction with other viruses or pathogens. Human herpes virus type H may interact with other viruses and pathogens, such as HIV, to create to the risks of cancer. For example, in people with HIV/AIDS, co-infection with human herpes virus type H is an important risk factor for the development of Kaposi sarcoma. Also, the immunosuppression people with weakness immune system, such a patient with HIV/AIDS, are at increased risk of the developing Kaposi sarcoma. Immunosuppression allows to the human herpes virus type H to replicate more easily and the cancer to develop more quickly. And the genetic factors are too less understood. Certain genetic factors can increase a person's susceptibility to Kaposi sarcoma, and other factors have been suggested, such as certain medical treatments, such as post-organ transplants, immunosuppression, and the certain immunodisease and environmental factors, but their precise contribution to the development of Kaposi sarcoma is still being investigated.
One of the tests to detect cancer due to Kaposi sarcoma is the PCR test for HHV8. The materials and reagents to carry it out are biological samples, These can be biopsies of affected tissue, skin lesions, skin lesions, or blood samples. PCR reagents, tag polymerase enzyme, deoxynucleotide, triphosphates, specific primers for HHB8, reaction buffer, nuclease-free water, equipment, a thermocycler, DNA extraction equipment, gel electrophoresis system. The procedure consists of extraction of DNA. From the biological sample, DNA is extracted using a commercial DNA extraction kit or a standard extraction protocol. The preparation of PCR reaction mix. In a PCR tube, mix 5 microliters of extracted DNA, 1 microliter of H primer specific for HHB8, 12.5 microliter of PCR master mix, contains tag polymerase, DNTPS, and buffer, nuclease-free water to final volume of 25 microliters, amplification in the thermal cycler. Place the tubes in the thermal cycler and program the following cycles. Initial desaturation 95 degrees for 3 minutes. Amplification cycles 35 or 40 cycles. Denaturation 95 degrees for 30 seconds. Alignment 55 or 16 degrees for 30 seconds. Extension 72 degrees for 5 minutes. Detection of the amplified product. Optionally, the PCR product can be run on a 2% agarose gel with ethidium bromide or any other DNA to visualize the bands under UV light. Alternatively, a real-time PCR method can be used to quantify viral DNA more precisely. Finally, the interpretation of results. Positive for HHB8, the presence of a specific band in the agarose gel indicates the presence of HHB8 virus DNA, suggesting a possible infection associated with Kaposi sarcoma. Negative for HHB8, the absence of the specific band suggests that HHB8 virus DNA is not present in the sample.
Treatment option for localized classic and endemic Kaposi sarcoma. Radiation therapy for solitary lesions or lesions of limited extent. Modest dose on radiation applied with a limited margin private. Excellent control of disease of the treated area. Usually superficial radiation beams such as lectures beams are used. For low voltage 100 kV photoradiation therapy 8 grays to 10 grays is given as a single dose of 50 grays to 20 grays is given over 1 week because solitary lesions control nearly 100% of local disease, but recurrence and acute case area is common. For electron beam radiation therapy, EBRT, for grace is given once weekly for 6 to 8 consecutive weeks with a 4 MeV to 6 MeV electron beam. Pores should include the entire skin surface 50 centimeters above the lesion. Surgery. However, multiple small excisions can continue to be performed for good lesion control. Other options. Alternative modalities such as cryo, laser, intralesions, and topical therapy can be used. Use of these modalities is based of evidence extrapolated from treatment of AIDS-associated cases. Treatment options for advanced classic and endemic Kaposi sarcoma. Radiation therapy. The type of radiation, i.e. photo versus electron, and fields used must be tailored to suit the distribution of disease and the individual patients. Extended fields EBRT for disease limited to areas distal to the neck, subtotal skin EBRT direct to skin below the umbilicals. For disease that extends above the neck, total skin EBRT for extends disease EBRT for grace given once weekly for 6 to 8 consecutive weeks and subtotal or total skin radiation therapy. Biologic and targeted therapy. Agents that modulate the immune system, such as imide drugs and interferon alpha 2b, have shown efficacy in both classic and AIDS association cases. Pomalidomide. Pomalidomide has been approved by the U.S. Food and Drug Administration (FDA) for the treatment of KS in patients with and without HIV. Pomalidomide is teratogenic, prescribed through a risk evaluation and mitigation strategy REMS program, and it should be given with spread to mitigate venous thrombosis risk. Interferon alpha 2D is approved by the FDA for treatment is AIDS association case. It is sometimes used off-label for classic cases. Immunotherapy. Immune checkpoint inhibitor therapy has been tested in classic cases and yielded promising results. Pembrolizumab monotherapy. Ipilimumab and nivolumab